If you have swollen feet, aching legs, or visible veins, chances are someone has told you to just wear compression socks. But here's the truth. Most people wear compression socks wrong or for the wrong condition, and that can actually delay proper treatment or even make things worse. In this episode, I'm going to walk you through what compression socks actually do inside your body, what conditions they help with, and most importantly, how to know if something deeper like CVI, also known as chronic venous insufficiency, is the real problem. Because compression can help, but it can't fix everything. And at the end of this video, I'll reveal the most important mistake people make with compression therapy, especially when treating varicose veins and lymphedema. First of all, let's get one thing straight. Compression socks aren't just tight socks. They're a medically engineered therapy. They apply graduated pressure, tighter at the ankle, looser as they go up. The gradient improves venous return, blood flow back to the heart. It also prevents blood pooling in the legs. Additionally, graduated compression supports lymphatic drainage. They also help to reduce capillary leakage, which causes swelling, something we also see with supplements like MPFF. Think of your veins as low-pressure tubes or conduits meant to bring blood back to the heart. Compression helps push blood uphill, fighting against the never-ending pull of gravity. Who benefits from compression? Let's break this down by condition. First of all, varicose vein and spider vein sufferers. This is caused by faulty valves in the veins, chronic venous insufficiency, also known as CVD, chronic venous disease. When these delicate one-way check valves fail, blood then pools in the lower extremity, and the veins stretch and bulge, causing itching, aching, heaviness, and sometimes actual pain. Compression reduces venous pressure, slows progression, assists in proper venous circulation, and relieves discomfort. The other thing that we see is swelling or edema. This is where fluid leaks from the blood vessels into the surrounding soft and fatty tissues, even the skin. Compression helps prevent that leakage, especially in the lower legs and ankles. It's also very important in lymphedema. Now, lymphedema is a lymphatic fluid buildup from blocked, dysfunctional, or damaged lymph vessels. Compression supports lymphatic fluid flow, but needs higher compression grade garments, 30 to 40 millimeters of mercury in some cases, as opposed to the 20 to 30 millimeters of mercury that is ideally recommended for people with venous insufficiency. Also, this kind of compression is often paired with manual lymphatic drainage, MLD, or complete decongestive therapy, CDT. Another area where compression stockings are very valuable is in standing jobs or people who do a lot of traveling or people who are post-surgery. Compression reduces the risk of DVT or deep vein thrombosis, especially during long car rides or long flights, or for people who have sedentary jobs who are sitting at a desk for many hours every day. Moving also helps in this. Walking, toe-ups, calf raises. In fact, I personally always do this myself when flying. On any flight longer than an hour and a half or so, I do toe-ups when I'm seated at my seat so that I'm doing calf raises. This really moves a lot of blood, believe it or not. And for longer flights, I'll definitely get up from my seat, walk around the cabin, go up near the restroom area, the galley area, and stand up and down on my toes 30 to 40 times every 30 to 45 minutes. I'll also do knee raises, one at a time, obviously, left and right, moving a lot of blood out of the lower extremities. This is a very healthy thing to do. It'll decrease the swelling that you get on flights, and it will also prevent DVT, or at least help to do so. I also stay very well hydrated on flights. I drink plenty of water and I avoid alcohol. The biggest reason I avoid alcohol on a flight is because it acts as a diuretic and actually will help you to urinate more than normal, which leads to dehydration. So sometimes when people are drinking and they're urinating a lot, they think that it's just the fluid that they're taking in, whereas in reality, you're passing extra fluid, losing blood volume, and becoming dehydrated. So stay active on flights, toe-ups, calf raises, and avoid alcohol, and take in plenty of water to keep the blood nice and thin, and do your very best to avoid blood clots. Graduated compression garments are also critical after vein procedures to support healing, decrease bruising, and manage inflammation and swelling. Now let's talk about great saphenous vein insufficiency. This is often underdiagnosed, and it involves the great saphenous vein, which runs from the ankle all the way up to the groin. This is a long superficial vein, and it carries a significant amount of blood back from the leg and lower extremity back to the heart. Now, when there's a problem with the saphenous vein and you have venous insufficiency and blood pooling in the legs, compression helps to control the associated symptoms like heaviness, night cramps, and the signs like swelling. But remember, this problem should be evaluated by vascular ultrasound mapping and an expert in venous insufficiency, because further interventional procedures may be required when symptoms are significant or when skin changes are present. So here's what the research shows. Compression therapy is a first-line treatment in most venous disease guidelines, chronic venous insufficiency, varicose veins, etc. Studies show that compression leads to significant reductions in leg pain and swelling, a slower progression of venous insufficiency, and better outcomes post-sclerotherapy and ablation when interventional treatments are required. They also lower the risk of post-thrombotic syndrome after somebody has had a DVT before. And many of these findings have been found to be even more effective when they're done in combination with dietary supplements like micronized purified flavonoid fraction, or what we call MPFF, which is a combination of flavonoids that have anti-inflammatory and antioxidant properties, and they're sourced from citrus fruit rinds. How do you choose and wear graduated compression garments properly? Well, this begins with choosing the right sock or stocking. Is it going to be a knee-high or a thigh-high? And that depends on your signs and symptoms. Now, for mild problems, we often recommend just an 8 to 15 millimeter of mercury compression garment, and this is suggested for travel, daily fatigue, etc. These are easy to wear, easy to put on, easy to tolerate. Just about everybody can use these. When you get into moderate disease, we then often go to a 15 to 20 millimeter of mercury compression, meaning that the compression is 20 millimeters near the foot and ankle, and will gradually get less to only 15 millimeters of mercury just below the knee if it's a sock, or at the thigh level, high thigh level, if it's a stocking. This is often used for mild swelling or patients with only a few varicose veins and spider veins. Now we get into firm compression, or what I like to call medical grade compression. This is 20 to 30 millimeters compression. Again, greater at the ankle and the foot, less as you go up. 30 at the bottom, 20 at the top. This is highly recommended for people with real varicose veins and moderate edema or swelling of the lower extremity. And then you can get into extra firm compression. This is 30 to 40 millimeters of mercury compression. And this is often used for people with more significant lymphedema. It's also suggested by some physicians in their post-procedure recovery period, although many of us use 20 to 30 then also. The problem with 30 to 40, although they're highly effective and it's a wonderful garment, is that these can be really quite difficult to apply, or what we call don. And we do have stocking donners that are available online or at your local durable medical equipment store, surgical supply, or pharmacy. Those donners can help people to get those really, really tight stockings on, which is valuable when it's absolutely mandatory. Some people don't tolerate wearing them because they're so tight, but when possible, it's valuable. And obvious problems in getting them on and keeping them on are in patients who are dealing with increased BMIs or obesity, those who have a poor range of motion and have trouble bending over to reach their foot to put this very tight stocking on, or even a lack of range of motion and strength in the hands when they're suffering from arthritis. So here's some key tips. Get professionally fitted, especially if swelling is significant. Always put your compression garments on first thing in the morning when your swelling is most likely to be at its best, meaning you're the least swollen after getting out of bed. Avoid folding or rolling the top over. This can create a tourniquet effect and cut off circulation in the lower extremity. They should feel snug, very snug in fact, but not painful. You should not develop any numbness, tingling, or pinching sensation in your lower extremity, foot, or toes. One of my other personal tips is I'm not a huge fan of the toeless garment because if it does slide up, it can cause swelling of the foot and ankle area. And I definitely do not care for a footless garment, so I do like the closed toe whenever possible. Here are some limitations of compression that I like to talk about and clues when to see a vein specialist. specialist. Remember, compression is a management tool. It's certainly not the end-all and be-all, and it's not a cure. And there is no cure for venous insufficiency or lymphedema for that matter. So it won't reverse the damaged valves, but it can slow the disease progression and manage the signs and symptoms of chronic venous insufficiency and chronic venous disease. Warning signs that you should go and have a proper evaluation is definitely unilateral swelling, meaning one leg only. This could be a sign of deep vein thrombosis, which can be a very dangerous and even life-threatening process that can lead to pulmonary embolism, or what we call PE. The other signs that you want to look for are skin changes, dark patches, thickening, nodular changes to the skin, what we call cobblestone appearance, severe itching, and again, thickened skin. Restless leg syndrome, night cramps, open wounds, sores, and ulcers. These are all absolute musts to go seek medical attention, see a physician, and see a vascular specialist with expertise in venous disease. Also, of course, if symptoms worsen despite using a compression garment regularly. Remember, many people with chronic swelling and pain have underlying reflux or backward flow in the great saphenous vein that goes undiagnosed, oftentimes for many years. And this is where an ultrasound-based vein mapping and an evaluation by an expert becomes critical. This vascular evaluation with ultrasound will rule out any blood clots in the leg and will also be able to determine the functional status of those veins and their valves. Venous insufficiency, unfortunately, is incurable, but the really great news is that it's very treatable and manageable with wonderful results, like so many diseases in the human body, but not with compression socks alone. And again, like so many other problems we talk about here on the channel, the earlier that you can detect and diagnose the problem, the better your results are likely to be. So what's the bottom line? Compression socks are powerful, non-invasive therapy that improve venous circulation, reduce swelling, relieve pain and fatigue, and slow the progression of venous and lymphatic diseases. But they work best when they're worn consistently and correctly, meaning that it's the right compression gradient, it's the right size, etc. You've got to be properly evaluated for underlying vein issues, and you should consider pairing the compression garments with movement, hydration, dietary supplements like MPFF, elevation, and procedural interventions like laser-based therapy and injections when indicated. Hey, please subscribe to my channel for more science-based answers to your vascular, circulation, cardiovascular, and longevity questions, and take control of your health one smart step at a time. Send this to somebody who would benefit from it, and I bet you they're going to appreciate you for showing how much you care about them. Thanks very much. I'll see you in the next video.